So today, Information Office of Wuhan Municipality held this press conference to introduce the work made in this regard. With us, we have Mr. Zheng Yun, Deputy Director of Wuhan Health Commission, Mr. Hu Yi, Deputy Director of Wuhan Market Supervision Administration, and Mr. He Zhengyu, Deputy Director and the Chief Physician of Wuhan Center for Disease Control and Prevention. First, I give the floor to Mr. Zheng. Friends from the media, good afternoon. I'm very glad to see you again here to introduce the disease prevention and control in a regular manner in Wuhan City. So, General Secretary Xi Jinping's principles that we should always stay alert and also never slacken off our efforts in disease prevention and control in order to win the full victory against the COVID-19. Wuhan always touch a great importance in this regard, and we talk about that disease prevention and control should be for everything else. That we should also do a good preparation in the good days and bad days. And we should also watch closely in preventing imported cases. And also to play a gatekeeper role, make sure that all gates are well protected and monitored in order to further strengthen the strategic achievements made here in Wuhan. So first, we focus on the key personnel and also the market. So we talk about that if the companies or personnel would like to invite foreign guests to Wuhan, then they should take the full responsibilities. So we should have a really strict approval systems and also make sure everything's traceable, and also do a good job in monitoring the foreign guests coming to Wuhan. Right now we have more than 16,000 people from overseas to Wuhan. 4,547 people in the centered quarantine, and the quarantine standards actually is in a closed manner. That's also the same standard as the contaminated area standard. From July 30th, the people from key areas in China, they should apply to our minister. We have more than 12,000 applications. Since July 30, 16227 personnel working in the transportation and selling the cold chain food. Their NAT is O negative. Second, we focus on the transportation of goods. Especially the special attention goes to the imported goods. Since the second half of June, the imported meat should all tested twice and also applied to the certain authorities, as the Mr. Ying Yong required. The cold chain food imported to Wuhan should be all taken samples, as well as the packaging should be all cleaned and the food should be traceable. And we also have the principles and the guidelines issued in this regard in order to further suspect, manage, and store the imported cold chain food. And we also have the role and responsibility list. We required the different districts, people from the health commission, from transportation, from the food quarantine, should all shoulder their responsibilities, make sure that from end to end we have a full coverage of the food chain trajectory, and also everything's written in record. And for the tools involved in transporting all these transportations should all be disinfected. And also during the transportation phase, the logistic companies that should do a good job in cleaning the trucks, the vehicles, and the tools and equipment used for transporting the cold chain food, and also make sure the imported cold chain food should be stored separately, and also have the specific personnel to watch all these food. And also we talk about the cold chain specific vehicles should be used for a specific purpose, and also should be parked separate from other vehicles, and also they should have the people in charge of the cleaning work. We also urge all the different districts and also the supervision departments should also intensify their efforts to do a good job in the market cleaning, as well as the disinfectant work in the different selling departments and the places. Since July, 60,380 samples have been tested for NAT with all negative results shown. And also in our testing of a cold chain food, 3212 the freezers actually had the sample taken, and including the meat and also environment. And we found that the pork imported from Brazil actually showed positive to NAT, and the rest are all negative results. Therefore, we had a full inspection into the meat imported from Brazil. So 200 environment samples and 112 workers, their NAT or O negative as related to these 3 cases of imported meat. But having said that, for the supermarket, for the vegetable market, for the freezers, we should have a specific people to do the cleaning job. Since the July, the supermarket, public transportation, bus station, the public washroom, 44683 samples have been taken from these areas. They're NAT or negative. We also conducted the drinking water, the polluted water, and also the water management plants, and also the and terminal water. And 224 samples were taken from these areas. All the samples meet the standards. For the polluted water, 1447 samples taken, and they're NAT or negative. Fourth, we also conducted targeted measures. Make sure that every chartered flight to Wuhan has a specific vehicles to carry over the personnel, and we also have specific parking places for flights, and also have specific passageway for the arrived customers to make sure that we can transport the passengers after they arrived in Wuhan and directly bring them to the quarantine area. And we also make sure the priorities based on the risk level of their departure cities. And also the PPEs are also in the full sufficient, and also conducted the NAT as required. And we also protect the people working in these areas. And fifth, we look at the implementation of the disease prevention prevention measures, make sure that we have enough the material supplied and also have enough hands in places, and that we do a good job in the environment cleaning work, and also have the people to do the inspection work, and also to provide the sufficient ground and proof to allow people of the quarantine places. And we also have the emergency plan if we found the confirmed cases or suspected cases. Make sure that anything happens, we can bring them to the hospitals as soon as possible, and also provide the kind, warm, and customized help to these people to Wuhan, and also to provide the psychological consulting service. And 6, we also watch the work conducted at the community level, and we look at the information collection and uploading system. Make sure that we have a window person and we can handle the work from the previous step to the next step, that we can have that seamless service carrying forward. And we have people going from Wuhan to other places will also be notified the destination ahead of their journey. 7th, and we also intensified our efforts in the nosocomial infectious disease. Jintan Hospital is the designated hospital. And we also had a notification issued in the fever clinic management, and we urged the people in the fever clinic to shoot the issues and found. And also the municipal CDC also conducted the inspections on the 27 hospitals nosocomial infectious work. Make sure all the measures can be implemented into details. 8th, we will also do everything we can to do the disease prevention and control work in the autumn and winter seasons. And we had 5 projects in this regard, and also improved the NAT testing capabilities. By the end of this year, make sure the second-level comprehensive hospitals and the CDCs can conduct or able to conduct NAT. We have 4 teams with more than 1,000 people and take NAT, and we also have the more than 10,000 people to do the supporting work. So if there are any emergency case happen, we have the enough hands to help. And also regarding the supply and procurement of the materials, and we had the standards that they should buy the sufficient product that's good for the people to use for 30 days in full capacity. And we also put a close eye on the high incidence infectious disease. And 94% of our targets have been hit in terms of the vaccines, flu vaccines for the young generations. And we also make sure that we can enlarge the production of the flu vaccines so we have enough supply to meet the demand. Going forward, we will further implement the disease prevention and control action plan made by the central and municipal government. Make sure that we prevent imported case and also prevent its further spreading inside Wuhan. And we will also have the alarming measures in place, and we'll put everything in our actions according to its letter. Make sure that we will maintain the hard-won achievements in Wuhan. Thank you. Now I'll give the floor to Mr. Hu Yi regarding the work made in the disease prevention and control in the cold chain food management. Friends from the media, good afternoon. I would like to brief you the work have been done in the market supervision department. Based on the requirement, we put our top priority to the cold chain food management and also the other measures in order to practice the normalized disease prevention and control. And first, we set up the A standard. We upgrade the A market in line with the requirement issued by the central and the provincial government. So we talk about the ventilation, the disinfections are all top of the agenda, and also they are checking list. Right now, 318 markets have finished all their upgrading work and all meet our requirements in terms of the normalized disease prevention and control. For the farmers market, actually, they also have the disease prevention and control measures in place, and they also right now practice these measures such as the temperature checking, the disinfection, and the disinfection actually happened on a regular basis, and the sewer and also the garbage bins actually cleaned twice per day. And for the product sold in the farms market, that also is stored and managed by different categories. And for the live birds or the live poultry, actually also the top of our attention, make sure that we'll provide safe and secured food to the consumers. Regarding the cold chain food, because that drive everyone's attention, that also involved different the stages, process, and department. For us, the supervision market places, actually we focus on the requirement of the cold chain food, and we actually make sure that our requirements according to the right zone requirement. So make sure that we have specific personnel with the specific tools to clean the cold chain food and also stored in specific places. And also that's for the environment as well as all this cold chain food. They also tested NAT and twice, and also make sure that they also applied the information to the related departments. For the issued food, and we will also give a follow-up attentions for the issued food, and they should also be traceable and actually make sure everything can be managed in a faster pace. Right now, we conducted 11 the cases and with the issues, and make sure that we can control all the risks. And right now, we have dealt around the 75,000 kilograms of the issued food. Right now, we also issued a catalog that consisting 127 categories of food, and we also have the uploading information system. Make sure the people in charge their information are available in our system. So far we have collected 30,000 information. So they are the watchdog for us to keep our door safe. Market actually is always the key places for us to strengthen our efforts in disease prevention and control. Going forward, we'll continue our efforts in this regard to make sure everything can be implemented in more detailed. Make sure that the supermarket, the farmers market, will do a good job in disease prevention and control in a normal manner to make our due contribution. Thank you. Now I give the floor to Mr. He Zhenyu regarding the disease prevention and control and also the personal protection in winter autumn season. We talk about the imported cold chain food actually draw everyone's attention. People is quite worried about whether these kind of food are safe to consume and what the things we need to watch when we would like to buy these kind of food. So the background is that in June, Beijing found the issues about imported food, and also after that, around 11 provinces actually found the positive NAT packaging of the imported food. So everyone quite nervous about the imported food. So we talk about that they also bring the additional risk of infection with all these imported food. So we make sure that we take our actions in the early stage, and we also make sure that we monitor and also clean the food from end to end, make sure that the virus could be killed at a very early stage. So we talk about whether they're easy to consume. Yes, of course. China CDC says that the public, if they consume the cold chain food, actually they just have a very, very minor risk level. And we talk about the COVID-19 actually cannot be infected by consuming contaminated food. So for consumers, they do not need to worry about that risk of infection. A lot of scientific data also demonstrates that COVID-19 actually cannot be infected by eating food, but actually you can be infected by touching the packaging or the people actually doing the processing food job. So we talk about that before coming to the selling stage, all food should be cleaned thoroughly. So in China, actually, we already laid out the principles of cleaning the cold chain food and imported food. We talk about that before that they handled by the personnel, and they should be first cleaned. And also, all these cold chain food should be managed in a closed loop. Make sure that we minimize the risk of infections. In order to doing so, Wuhan always take everything we can to prevent imported cases, that not only to the personnel, but also to the items and important food. So far, for the imported cold chain food, actually have a specific team of personnel to manage all these food in the specific places. So far, actually, everything is well guaranteed and risk is well managed. And regarding the second question, what kind of the issues we need to pay attention when we would like to buy these kind of food. So first you need to go to the supermarket, and first you need to use the a plastic bag to cover your hands before you touch the cold chain food. Make sure that your hand not directly touch the cold chain food, and also you should wear masks. And also you need to make sure look at whether they have the food information. Make sure you consume these kind of food within their valid date. And also after you purchase all these food, you need to keep your hand hygiene, wash your hand, and also make sure that before you're washing your hand, do not touch your eyes, nose, and mouth. And third, we talk about how to clean these kind of the aqua food or the cold chain food. So before processing these kind of food, wash your hands, and when you're processing the food, please also keep washing your hand frequently, or you need to wear the plastic glove to protect yourself, and also clean the food after processed all these food, and also make sure that you have the bowl that you can have the water in the bowl to clean all these food. Make sure that the water when clean these food and not spilling over to the other places. And for the knife, and also the a board that you processed the food, also be well cleaned, or you use a specific knife and board to chop all these food. And make sure you always clean your food, and also especially clean your hands again when you process the boiled food. And for the freezed food, actually you need to use the specific tools and also clean them immediately and also store them separately. Make sure that you stay away from the cross infection. We talk about the COVID-19 virus actually could be killed at 50 degrees after boiled for 30 minutes. So make sure that you boiled or cooked well all these foods, especially the seafood. And also make sure that you store the kind of food in the freezer and also separate from other food. And for the kitchen, make sure you conduct ventilation. If necessary, please also disinfect the bowls and the chopsticks. Fifth, for the leftover seafood, make sure you consume them as early as possible and also well cooked before consume again. Make sure that you cook all these foods reach the 70 degrees. And we talk about autumn and the winter season. Actually, is a high influence season of flu, and we also see that the sporadic cases of COVID-19 happened in different places. So we should never slacken off our efforts in fighting against COVID-19. So which means we need to protect ourselves well. So you need to do the following 5 things. First, wear masks, and also bring the masks always with you. This is a good habit because masks can prevent the spreading of the virus, especially when you take public transportation, the elevators, you need to wear masks. And for the people on their way to the different clinic or the people at the front line, you always need to put your mask on. For the people with the underlying diseases, we also encourage you to wear masks. And second, keep social distancing. When you come to the high-density places, please make sure you keep that 1 meter safe distancing. That will help you to prevent from the infections by virus spreading from the droplet. And third, keep your personal hygiene and wash your hands frequently. And based on the research that the sanitizer or the soap with the flowing waters actually can help you to clean your hands, and also use the tissues or your elbows when you're sneezing, and also keep the ventilations. And will lower the contamination of the virus. Make sure the air in the room is flowing. And fifth, that if you are not feel well or you have the symptoms showed, and please do not go to working places. And if you have a close contact history with the infectious or the suspected cases, do not take public transportation. And if you take public transportation, please scan the code or use the electronic way to pay the fee. And also please wear masks, and also make sure that the temperature is measured. Thank you. Now the floor is open. My question regarding the measures taken in the disease prevention and control efforts in the farmers market. So we talk about farmers market actually is a vital places in preventing the disease spreading. So we talk about the high density places. So it's really challenging work, but we have done the following. So first, we require the people entering to these markets, they should put their mask on, and also they scan the code, the healthy code, and also they should wear masks. And temperature is measured. And second, for the farmers market, should be totally cleaned once. And for the sewer, for the garbage bins should be cleaned twice. And for the imported cold chain food, they should be fully inspected before entering to the market, and they should have the certificates before entering to the market. Otherwise, they are not allowed. And also for these kind of food, they should be stored in a separate place, so people feel safe when they shop in these kind of markets. Thank you. Xinhua News Agency, and in China, actually, we found the cases in different places that the NAT positive actually showed, and the packaging of imported food, and what measures we have taken to prevent these kind of cases happened. Thank you for your question. The provincial market attach great importance in the imported food risk. Make sure that we always take the active actions to monitor, clean, and inspect these cold chain imported food. So for the processing and selling these kind of food, we conduct three things. First, we conduct everything according to the requirement and standards of the right zones. Make sure that all these kind of food actually storaged up to the requirements. So we have the specific personnel, specific tools, specific channels to transfer these kind of food by specific vehicles, and also stored in specific places. And also these kind of food should all have the certificates, which means they have that approvals. So they have two certificates. So that's one certificate from the custom, and also a certificate from the inspections department, and also they should have NAT report. If they don't have these three things, they should not be allowed to sold in the market. And we also talk about that the information, the place, the quantities, imported companies, the export companies should all have that information available. Make sure that everything's traceable, and we know the whole trajectory of these kind of food. And would like to call on everyone, do not to buy the cold chain food in any places. Please go to the regular places. Make sure that you buy a safe food. Thank you. Thank you, our guests, and thank you, our friends from the media. Thank you all. We talk about disease prevention and control in autumn and winter, always are top of our agenda because that's so close linked to people's health and safety. So we also would like to call on our friends from the media to do a good coverage and guide the public to never relax the mindset, and also protect themselves well. Thank you all.